Hey, this is Dr. Ankur Prakash from Living Well Balanced. Enjoy this amazing video by our all-star physician assistant, Joshua Corwin. It's about high-dose vitamin C IV therapy. To learn more about chiropractic care, the benefits of medical massage therapy and the IVs and everything natural that we do in our office, please make sure to subscribe to our YouTube channel and definitely click the bell. That way you'll be notified when we get our new video out.
Hi everybody, here today to talk about high-dose vitamin C, also known as ascorbic acid. Vitamin C is one of the essential vitamins required for immune function and metabolic function within our body. Here at Living Well Balanced, we offer a variant of vitamin C infusion therapy called high-dose vitamin C. We talk about vitamin C dosaging as a typical recommendation for daily function. It's anywhere from about 900 milligrams to maybe 2,000 milligrams or 2 grams of vitamin C per day that most of us need. Our high-dose vitamin C infusions here start at 25 grams and we work up to a 75-gram dose here. So much more than the typical dosing. Typically, vitamin C helps to increase iron absorption within the body. One of the important things that we think about with vitamin C is that it's a water-soluble vitamin. That is to say, our body is not able to store it in significant quantities there. So whatever we take in that we don't need at any particular time, we excrete typically in urine in humans. With that said, it's important that we get a continuous dosing throughout the day, throughout the week, in order to prevent negative side effects from occurring. When we talk about high-dose vitamin C, one of the applications that we use it for is as an alternative or complementary cancer treatment. There is some fairly compelling evidence that vitamin C in high dosages may have two potential benefits in the fight against cancers. One is that we know that most tumor cells require glucose, or the most basic form of sugar, in order to continue functioning. In other words, tumors need glucose to stay alive. And in particular, there are certain kinds of tumors that thrive on glucose consumption. For reasons that are not totally well understood, many tumor cells seem to be tricked or fooled by high dosage of vitamin C in the body and think that they are essentially gorging on glucose when in fact they're gorging on vitamin C. And the vitamin C then causes what's called cellular apoptosis, or a fancy word of saying that the tumor cells just get super full and basically rupture and causing death of the tumor cells there. One of the other potential benefits of high-dose vitamin C intravenously is that it may prevent angiogenesis, or new blood cell formation specific to tumor cells. For reasons also not entirely understood yet, the working theory is that high-dose ascorbic acid will actually damage the mini blood vessels that are forming, but only to tumor cells. So that's another benefit that we sort of talk about here. It's really important that we mention that this is not a replacement therapy for traditional oncology care. This is a service that we offer typically in conjunction with patient's own research or in conjunction with patient and oncology decision process here. The typical time commitment is typically twice a week, and we try to get up to a fairly high dose, upwards of 75 grams here, to provide the most benefit here. Most patients don't really experience any side effects at all. Sometimes, as we are increasing the vitamin C dosing to get up to the higher doses, there is a slight burning sensation in a vein, or sometimes a little bit of cramping, and that goes away fairly quickly once we slow down the rate of infusion for people if necessary. One of the questions that we get asked about high-dose vitamin C often by our cancer patients is if we're able to access an infusion port. Simply, the answer is yes. We have all the equipment and supplies that are necessary to perform a sterile accessing and deaccessing of the port here in our clinic setting, and follow strict aseptic and sterile technique exactly the same as is done in the hospital setting. Be happy to talk with you at length about this and answer any more questions I might for you in person. Thanks.
Thank you so much for watching our video. If you got a gem or two out of it, please make sure to like it and share it across your social media. If you haven't subscribed to our YouTube channel, please make sure you do that, and definitely hit the bell so that way you get alerted every time we get a new video release. Speaking of videos, we got 2 great videos right here.